Fracture of nasal septum. Facial trauma can result in fracture of nasal septum. It may be inflicted on the nose from the front, side, or below. The nasal septum can get buckled or fractured vertically or horizontally. Figs 1A and B. For nasal bone fracture, see chapter Maxillofacial trauma. Features. In a smashed nose, septum is crushed to pieces, which may overlap each other or project into the nasal cavity. A crushing blow from the front may cause buckling, twisting, fractures, and duplication of nasal septum with telescoping of its fragments. Trauma to the lower nose can cause fracture of the septal cartilage or its dislocation from the vomerine groove, without associated fractures of nasal bones. Septal injuries usually lead to profuse epistaxis. If the septal mucosa is intact, septal trauma can cause septal hematoma, which should be drained early to prevent absorption of the septal cartilage and saddle nose deformity. Types. Jargive fracture Fig. 1a. This horizontal fracture starts just above the anterior nasal spine and runs backwards parallel and above the junction of septal cartilage with the vomer. It results from blows from the front. Chevalet fracture Fig. 1b. This vertical fracture starts from anterior nasal spine and runs upwards towards the junction of bony and cartilaginous dorsum of nose. It results from blows from below. Treatment. They need early treatment. Hematoma is drained at the earliest. Dislocated or fractured septum is repositioned and supported between mucoperitoneal flaps. The mattress. Sutures are taken and nasal packing is done. The associated fractures of nasal pyramid are treated concomitantly. Complications. Deviation of the cartilaginous nose. Asymmetry of nasal tip, columella, and the nostril. Septal hematoma.